I would like to welcome up Deven McGraw. She's the Chief Regulatory Officer at Ciitizen, and Vince Kuraitis, Principal at Better Health Technologies. Deven and Vince will briefly describe the Goldilocks health data dilemma and will provide an overview of two specific areas affected, and those are, how are policymakers addressing health data privacy risks? And number two, what is the impact on business models? Please welcome Deven and Vince. Thank you so much.
Thanks, Cynthia.
Okay.
All right. Is your personal health data protected? Who thinks it is? Raise your hand. Wow. We don't even need to go any further,
That's
Vince.
it.
They already know.
We're done. So we have a little bit of a dog and pony show here, just a heads up. Imagine in this box is your lifetime of health data. And I'm working this off of statistics in a recent McKinsey article. 22, actually the number is a little, this is an older version of the deck. It's 1,100 terabytes. Or that's the equivalent of about 2,200 of your current PCs. How much of that data is actually protected by HIPAA? The analysis that McKinsey goes through, okay? You got to stare really, really carefully here. In the very, very bottom left corner of this slide, it represents, there's a green shaded area that represents the area of your data that is protected by HIPAA. And this is 2,780 times the amount shown in the previous slide, which is data not represented by HIPAA or not protected by HIPAA.
So this was our only argument to date, actually, which is, I said, that graphic, first of all, it reminds me of Christmas, because it's red and it's green, and it's September and I'm not ready for Christmas yet. And second of all, there are other graphics. There's that cool one in Nature magazine of the iceberg with the, which just has the HIPAA data on the top and there's a huge volume of data underneath the iceberg. And then we could do, some sort of Venn diagram. What is that graph?
Well, Deven hated my graphics, but she graciously allowed me to present them anyway. So there is a synthesis here. Deven?
Yeah, no, ultimately he convinced me because those other graphs just did not show the huge volume disparity between the HIPAA and the non-HIPAA covered data. And here's why. Because ultimately in the ecosystem that we are diving into that really arguably already exists today, all of your data is health data. It's not just the data that's in your clinical records. It's not just the data that's in your claims records. It's not even just the data that might be collected by a medical device implanted in your body. It is data that can be used for health-related purposes to address health questions, can be any type of data. Social determinants data. How many of you were here for Poppy Crumb's presentation yesterday? Basically, our homes are now spying on us. And our cars are spying on us, and we already know the internet is spying on us. So that is all data that potentially could be used for health purposes.
Okay. So Deven and I have a series in the healthcare blog. We'll show you a picture of it a little bit later on. It's called the Health Data Goldilocks Dilemma. What do we mean by the health data Goldilocks dilemma? Sharing data, privacy, or both? Don't want to overcomplicate it for you. The issue and the reference to Goldilocks is simply, how do we share the right amount of data? Not too much, not too little.
So in terms of one side of this Goldilocks dilemma, which is privacy concerns about data, right? Those concerns have always existed. Really, we have HIPAA because people back in 1996 said if we're going to digitize claims data, we need to make sure there are privacy protections that protect it, and that was really the genesis of our HIPAA privacy regulations. But today's scandals dwarf what we were thinking back in 1996 by 1,000-fold. And these are just some headlines. We could have picked we could have had a plethora of headlines.
We
to
had
pick there.
dozens of articles to pick from here.
Yeah, I mean, but at the same time, we are trying to move ahead as swiftly as we possibly can with getting more data digitized, putting more data in the hands of patients who can share it in consumer-facing apps that are not covered by HIPAA, more data from wearables, devices. We've seen basically an entire conference dedicated to the collection, use, and sharing of more and more data, because that is going to help us get to the next level for our own health personally, as well as for our systems, both here and abroad.
The collective unconscious, I think we've all become far more aware of how much of our data is actually out there, and most people, I think, are outraged by the fact that these large tech companies have our data. That has not yet, for the most part, happened with health data. But hang on. Okay, so two trends are approaching tipping points. And I think this one was your slide, Deven, so go ahead.
No, it's okay. Again, health data sharing. Here in the US, we have policies that are speeding down the tracks toward preventing information blocking, to making sure that data can be available to patients and tools that they use, as well as to tools that clinicians use through FHIR APIs. The idea is this data has been siloed for way too long, and we need to push those silos open and make sure that that data can be shared. At the same time, we've got these privacy concerns we talked about, right? So, I mean, I think those headlines say it all. We have HIPAA providing limited protections to an ever-increasing amount of data used for health. We don't have enough. Necessarily. They do a better job in other countries of protecting data through data protection laws like GDPR. Here, we protect by sector. We've got the healthcare sector relatively covered. We've got this entire ecosystem of data now less covered.
Okay, so what are the risks here? On the one hand, the risk is we share too little data. Our clinicians don't have the data they need to be able to make accurate diagnoses and prescriptions. The promise of artificial intelligence and machine learning is based upon having heaps and heaps of data, millions and millions of data points, which in turn fuels the promise of personalized medicine. So if we don't share enough data, those are some of the risks that we stifle all this innovation that is just around the corner. On the other hand, the risk is we share too much of our data. We lose our privacy, we lose security of our data, we have Equifax-type breaches, we lose trust in our healthcare providers, we lose trust in institutions, and most recently, the recognition that the profit off of this data is being taken by third parties has fueled a new trend in the marketplace of potentially compensating people for their data. I'll talk a little bit more about that. But there are definitely risks of sharing too little, too much. We're looking for the middle ground. There are many tentacles to this Goldilocks dilemma. And we have invited guest authors to contribute, because I think what we've been trying to do is really to frame the issue. We haven't been particularly opinionated yet, although I think as I get into this, I'm getting more of a sense of we're going to need to be a little bit more opinionated, because we do have points of view about where this needs to come out in the wash. Today, we'll only cover the first two. Deven's going to talk very briefly about federal and state legislation, and then I'm going to talk about impact on business models. But we wanted to share with you this notion of this Goldilocks dilemma covers a lot of territory. Deven, you want to talk just a little bit about what's going on in Congress?
Yeah. Well, I'd love to, if only I knew. There may be people in this room who are sitting in the backdoor conversations that are going on right now on sort of what Congress may do in terms of privacy legislation. There's definitely pressure from companies to act, and that's kind of unusual, right? Usually companies are the last ones to say, please regulate me. But in this case, they've got some issues to deal with, which is that if they are global companies, they're already having to comply with the global data protection regulation for their customers in Europe, and they would prefer to sort of have a more level playing field. There's also state law in terms of California having already acted on a law that will go into effect in January, which has very strong rules around sharing of personal data. And other states are thinking of acting as well. So as the states start to act and companies are faced with this regulatory environment around needing to comply with very different laws in different places, that creates, I think, some pressure. They'd also love for the state laws to be preempted by a single federal law, because that's just much easier from an operation standpoint. There's also threats to interoperability initiatives. It's certainly been reported in the press how, and I think even Dr. Rucker has spoken about it at this conference, where there have been concerns expressed by the healthcare community about the lack of protections for data outside of HIPAA, and how can we be pressing on the gas so hard on some of these interoperability initiatives when we don't really have sufficient privacy protections for the data when it gets outside of that HIPAA bubble. And then, of course, it's not like there isn't a cop on the block. There's the Federal Trade Commission, which always has this really broad authority over commercial companies to hold them accountable when they don't fulfill their commitments to their users around how data are going to be used, or when they act unfairly with respect to personal data. But the recent Facebook settlement and the disappointment expressed by the privacy community and by a number of members of the public about how weak that settlement was purported to be has people now doubting whether the cop on the block has strong enough authority to address this issue.
Okay. I'm just going to touch on what impact there may be. I work with companies, startups, established companies around helping them with business models and strategy. And I'm really very optimistic. I think you heard Don Rucker reference this yesterday, tomorrow, that this notion of consumer-controlled data has the potential to create all kinds of new business models. So this is really just a first touch of what is happening in the marketplace. Personal data platforms where you can use your data as you can use them as a locker, and many of them, in fact, my colleague Jody Rank and I are tracking over 60 different companies that are now allowing you to put your data into their platform and then help you sell that data to some third party. 25 of those plus are focusing on healthcare data. It's a vibrant marketplace. Another area is around privacy as a competitive differentiator, where the best example, I think, that we've seen of this is Apple, where they say explicitly, we don't sell your health, we don't sell your data, we sell hardware. And privacy protection technologies, one of the articles we had by Dr. Mariel Gross recently and Bert Miller talked about the potential, particularly for crypto technologies, for Z-snarks, for blockchain technology, et cetera. Those are great tools potentially to implement some of the privacy protection that is needed. And then there are others, consent management platforms, and I think we'll see a lot of wild cards out there. This is just an exciting area. I think we're going to see a lot of innovation.
So in closing, if you write on this topic, if you have thoughts on this topic, we would encourage you to put a blog post together and submit it. Vince and I are going to write some more too. As he said, we need to start getting more prescriptive. I said, you assume we are going to agree on what those prescriptions would be.
Okay. I'm sure we'll
Could
work
be
it out.
interesting. but stand by for more.
Go to the healthcare blog to find the series. In the red circle, click on it, and you'll find there's already about five, 6 articles in there. Yeah. That's it. So
now we have Mike
we're ready to take your questions.
Yeah.
Have a seat, please.
Thank you.
Thanks, guys. All right, my name is Mike Millier, and I'm editor of Healthcare IT News. And with the time we have left, let's try to get to a couple questions about this very complex but very important subject. As we all know, ONC and CMS have a couple proposed rules out that another former ONC guy, Doug Fritzma, told me not long ago. These rules are going to shape, the trajectory of health IT for the next 5-10 years, perhaps. So the stakes are high. But as you mentioned, big groups, American Medical Association, American Hospital Association, have big concerns about, the data sharing that is at the center of a lot of these rules, especially ONC, has prioritized patient access. And so how do you see this playing out? Because it's not an easy question.
No, it's not. I mean, I think we were talking about it. I will say, as somebody who has fought long and hard for the right of patients to get their data in many iterations throughout my lifetime, it is dismaying a little bit to see these concerns expressed at the last moment, like, no, stop, don't go there, because now the data is going to leak out into the HIPAA uncovered world. Well, I got news for you. It's been leaking out into the HIPAA non-covered world since HIPAA began, because healthcare providers are not limited to sharing data just with other HIPAA-covered entities. They just have to have the appropriate permission to share data within HIPAA, and then once they push it out the door, where it goes and to whom it goes and whether that entity is regulated is not an issue. Researchers are not covered by HIPAA. You can share data for research purposes. Public health agencies, now, hopefully we trust them, but it's just an example of, if you have a HIPAA-permitted disclosure that you've done, you're sending it out into the world, and it's probably not covered by HIPAA out there, but it never was a concern to anybody. Until now, we've got patients potentially being able to exercise their right to get their data, and now, oh, Nellie, bar the door. We can't have this happen. So there's a little bit of that that's operating inside, even though, again, privacy advocate for many years, yes, I can see how that non-regulated space, being as large as it is a concern, and one that I do hope Congress will address.
So ONC has come out with a policy recently, Seema Verma, Alex Azar, Don Rucker, the notion of patient-controlled data. Patients will be in charge. And intuitively, that's very appealing. It sounds really, really good. But I think that's only half of the story here. And the other half of the story is, in the absence of stronger federal protection legislation, that it's very foreseeable that your health data, whether it's HIPAA protected or not, is going to be out there in the same way that you were surprised by Facebook having all of this data. Your healthcare data is now going to be subject to that. So when we talk about getting more prescriptive, I think one of the things I'll say is, we need better federal privacy legislation. I think that needs to be, one of the main takeaways I hope people will get from what we're learning about this. We really don't have the laws at the federal level to protect us.
When you talk about data being out in the wild, so it may even be a moot point. We were talking earlier about this JAMA article that said just 0.7% of patients who log into portals where they can access their data have actually tried to move it into apps on their smartphones, which I was surprised that number was so low. Were you guys?
No, it actually didn't surprise me. I don't think that functionality works very well in portals today. I think the idea is that in subsequent iterations of certified EMRs, the technology will be required to facilitate that in much more obvious ways through FHIR APIs, and that I think otherwise, look, I probably all of us have portals. Some of us have multiple portals. The ability to sort of get all that data into one place today it just doesn't really exist in many places.
Today's portals are abysmal, but I think in the long run, we're going to see a very different world. You've heard other speakers, probably a number of them, make references to network effects in healthcare. I think the whole notion of platforms and network technologies is just beginning to enter the vocabulary in healthcare. So what we're at today is people use the word network effects. Well, a company called NFX has specified 13 different types of network effects. We need to get a lot smarter. And patient portals are the perfect example of a network effect or a network technology. I value having more apps on my portal. I value having more physicians that are on my portal. Those are all part of the network that we're trying to build. That kind of vocabulary has yet to enter healthcare.
There was a speaker yesterday who was talking about a shifting of the conversation from access to control to ownership. Where do you think we are on that journey? And further, what do you think of this article in Wired recently that said that if all these AI algorithms are so hungry for your data, that you should be getting paid for giving them your data?
Well, there's a lot of topics packed into that. I will say that the concept of data ownership is a bit of a red herring. It's a great rhetorical tool, and we use it, frankly, a lot to talk about, patients' rights, patients own the data. It sort of falls apart as a legal construct because the reality is if you possess that data, you have both rights and obligations in it. If you think about HIPAA giving patients, at least for HIPAA entities covered by HIPAA, the right to get copies of their healthcare information, and yet it's really, really hard for patients to do that because the record holders possess that data and set the terms under which they give it to you, even though it's yours or you have a right to it. So but having said that, when you do get it, can you then put it somewhere where you have the right to sell it? I think it's a really good question.
So I just would like to agree with you, Deven. I think as a legal construct, the notion of property rights ownership in your data, it's just a distraction. It really doesn't get you very far. Data as a human right, now that's a different discussion. Should we be able to sell our data? It's going to be a difficult marketplace. And again, the notion of understanding network technologies is something that has to enter the healthcare vernacular. So today, let me give you an example of that. So ultimately, in the end state of this market, where it's going to be, buyers are not going to want to go to 97 different places to buy data. And you, as a owner of data, you're not going to want to sell your data to 97 different places. So this begins to set up the dynamic that we see with companies like Facebook and Amazon, where there's a strong tendency towards a winner-take-all type of a marketplace. But we're not there today. We're not anywhere near there today. And as I mentioned to you earlier, there are 60 companies you can go to try and give them your data so that they can sell it on your behalf. And none of these companies have, at least that I've seen, come and correct me if I'm wrong, yet have any kind of critical mass to be able to have enough buyers and sellers where there's a liquid marketplace. We got a long way to go.
I would say, look, it's really hard to sell data you don't have. Right? Like you can give me all the rights on paper, but if I can't actually get my data, then I can't sell it, in addition to all the issues that Vince raised.
All right, we got 30 seconds left. Let's look into your crystal ball. You've told me you don't see this getting resolved without legislation of some sort. We've got GDPR in Europe, we've got the California law. Do you see U.S. Congress stepping up and doing something on this front that's valuable and forward-thinking, I suppose?
Not this year. I hope in the next couple of years, but not this year. Election's going to get in the way, too.
I'd frame it a little differently. I would agree. I'd say 30% chance this year, but 90% chance we'll see legislation in the next 3 or 4 years.
Fantastic. Thanks to you both. Terrific
Thanks,
presentation.
Mike.
Thanks,
Thank
Mike.
you very much, Mike.